Hi there, my name is Matt Diller and I am a first-year Doctor of Physical Therapy student at Midwestern University in Glendale, Arizona, and today I'm here to talk to you about total hip replacements and the precautions one should take post-op for sitting and how to properly sit after the surgery. So, a total hip replacement or a total hip arthroplasty is a pretty common procedure found these days. It involves replacing the entire hip joint out with prosthetics. And there are a couple different variations of hip replacements. So today we're talking about a total hip, posterior approach, cemented. So that means posterior approach means the incision site will be on the back side, which will bring up some complications we'll talk about here in a sec. And then a cemented is the adhesive used to glue the prosthetics down to the bone. Whereas in some cases you may see no cement or non-cemented, which would mean just natural healing. But for the purpose of this video, we're going to talk about cemented, which does allow weight bearing after the procedure, so we can talk about sitting. So after this, I do have some visual representations to show about the prosthetics involved, and then the precautions we're going to take in a demonstration video at the very end to show what sitting looks like before surgery, and then what a patient can do post-op and how they should sit for the recovery process. Now we can get some actual visual representation for the total hip replacement. So the prosthetics involved in a total hip replacement are going to be here on the left. So we have a femoral stem and a femoral head that are going to go into the femur itself. And then going into the pelvis, we have the acetabular component, which can be seen on all the slides here. So those will be inserted into the hip and the femur to create a total hip arthroplasty. Whereas in a partial one, we may only see just the femoral portion involved, and then the actual hip acetabulum will not be replaced. So that's what makes a total hip replacement unique, is that it's a full joint replacement involving both the femur and the hip and pelvis. So if we look at the posterior approach, what we're going to be talking about today, this approach to get to the hip joint involves cutting through a good amount of muscles to get to that, so that will create a lot of the precautions on not being able to sit properly. So if you look on here, some of the muscles involved are the gluteus maximus, which will be slightly cut open, and then all these muscles going all the way to the fascia lata at the end. Everything in between that will be the rotators of the hip, which will definitely be cut during the procedure, and then the fascia lata or the tensor fascia lata will also be incised during the procedure. So the recovery of these muscles will also give a rise to the precautions that we're going to talk about on the next slide. So the first picture on the left here, as far as hip precautions go, we won't be talking about picking items off the floor, but this one does show going past 90 degrees, which is a precaution that we have. We can't let the hip bend past 90 degrees during rehabilitation. The second picture of the patient crossing the legs involves three motions that are going to be precautions that we have to watch out for, which involve internal rotation of the hip, adduction of the thigh, so bringing the leg across the body, and then of course there is bending past 90 degrees as well in that picture. So those are the three motions we do not want to have as a precaution due to the muscles that were cut through during the procedure. That increases the risk of a hip dislocation. So this first video demonstrates how someone would normally sit, which is going to have more than 90 degrees of hip bending, and crossing the legs and then getting up also will have more than 90 degrees of hip bending, which is something we're going to want to avoid when we get to the post-op. In this video, we'll look at the post-op now and the proper way to sit. So in this case, we're using an assistive device for weight bearing. On the right leg is the operative leg, and we're going to use the arm rests to ease our way into the chair to keep it up straight and not go past that 90-degree mark, and as well as for getting up from the seated position. So to add on to the last video, in that case we did have armrests, so that's a good way to support your weight going down. Some other methods, if you don't have armrests on the chair you're trying to sit on, then you could use a higher seated chair possibly, or weight-bearing devices such as a walker or a cane. That would be a good substitution as well. And of course, even not sitting all the way down on your chair, so like sitting on the edge of your chair would be a great option as well. But that does cover everything I had for total hip replacements and the precautions that come with sitting. So thank you for watching, and I hope you have a good rest of your day.